Okay. So basically, these are some of the slides. So you first take a plastic sheet, put it on the chest, covering the abdomen. Basically, it's not a very difficult thing to drape a cervical area because it's a very small area or the operating field is not very big. You put a large plastic sheet first, which goes from the clavicle below, covering the chest and the abdomen. Okay, that is the first sheet. This is now covered with a cloth drape, which will go from the edge of the plastic, yeah, to the pelvic area. Now, the second sheet comes from the head end, fold it, the edge, fold it onto itself, and just let it fall just at the level of the chin. The big sheet here is now covering the lower half of the body, the legs. So as you can see, part of the iliac crest is being left open in between. So probably that is also taken care of for the graft that you may need for the cervical procedure. So here now two sheets come, one from the right side and the other from the left side. Depending on the operation site or the side from which you are going to go in, you leave that much area exposed and rest of the area you just cover with 2 layers of drape. So as you can see, it's just a rectangular area of the neck which is left open. Take the second layer of drapes and put it on. Lastly, put the screen on, which will isolate the head and the anesthesia trolley from the operating field. So the operating field is not seen very clearly here, but as I said, right from the base of the chin, it goes up to the upper end of clavicle, a rectangular area which is left open. Yeah, so that is the area which you can see, wherein you operate on the anterior cervical area, whatever, either excision of the disc, plating, bone grafting, fusion, all these surgeries are performed from this small incision. Okay, now we go for the iliac crest bone grafting. So again, the patient is in the same supine position, anesthetized, scrubbed and prepared. One plastic sheet goes above, one below, and then similarly, just a small rectangular area of the iliac crest from where you need to take the graft. So this is the video. So you isolate the iliac crest from all the 4 sides, leaving only a small square or a rectangular area of the iliac crest exposed from where you need to take a graft. What is not shown in the video is before you start draping, you put a sandbag underneath the side of the buttock from which iliac crest you are going to take the graft, so that you elevate that side and make the iliac crest prominent. So as you can see, all these incisions would do better because there are just 4 sheets coming from 4 sides, isolating the or leaving that operating field area open. It's always better to use adhesive Surgery drapes like Surgery drape, which are adhesive, so that they keep the sheets in place, like Ioban or Surgery drape, which are adhesive, and they would keep the sheets secure in place and not allow them to slip and fall or move away from the operating field. So that was about anterior cervical spine and iliac crest bone graft.